Everyone, welcome to Tuesday 13th of May 2025. This is the lovable show that you always love and enjoy because we bring you health topics. I'm your host today. My name is Sister Malango Goma. I'm not alone in the studio, but before I go and introduce my guest for today, here's a brief introduction to the topic that we have today. So today we're talking about a disease, a condition, whatever you want to call it, but it's something that we call as a silent killer. Hypertension, also known as BP. I know some of you, when you just hear BP, BP, but we all have blood pressure. It could be low, it could be high. So today we're now going to talk about high blood pressure, which is hypertension. All right, so now something that you need to know is hypertension is now common, even here in Zambia. It's not just amongst the elderly, it's not just amongst the pregnant, it's not just about those who are stressed up and all that, but it's affecting everyone. Even people who are very slender, you find that they really have the hypertension. So that is why we're going to dive into this topic today and get to educate you. I'm happy today I have a beautiful woman. Teledoctor always brings in the best, actually. So help me welcome Dr. Agape Dube. Dr. Agape, you're welcome to Teledoctor.
Thank you so much.
All right. So now I love the name Agape. But how would you want to be addressed? Do you want
Dr. Agape or Dr. Dube is fine.
Okay. So who is Dr. Agape Dube? And yeah, just tell us a bit about yourself.
Well, Agape Dube, as you have mentioned.
Yeah.
I'm a family physician resident, which is a registrar at the University of Zambia, and currently stationed at Chilenje, which is where we primarily work for primary care in family medicine.
Okay.
I'm also a dementia care coach, which helps families and dementia patients in aiding them to do better as they tally along with the condition that they have.
Oh, beautiful. And apart, I think you have a lot on your plate dealing with dementia and also the family medicine. So what do you do in your free time? Do you even have free time?
In my free time currently, I like to cook.
Ah.
Yes, cooking, and well, I can't do that now, but I love hiking.
Yes. Wow. Once you cook something, because we have African Freedom Day coming up, so prepare a traditional meal for me. I'll
definitely do that. I hope you're able to eat Zimbabwean South African food.
I'm a foodie. I eat anything.
That's great.
Okay, I love the fact that you've put up the issue of family medicine. So I just want to find out, what is family medicine and why is it important? Because most of us never knew about this wonderful specialty. Yeah. So what is it?
Family medicine, it's a growing specialty, especially in Africa now. In Southern Africa, Zimbabwe and South Africa and Botswana already have it.
Oh.
And in Zambia, it's slowly growing and the numbers are getting bigger. We started off with one family medicine registrar, and we're now 44, which is it's an enlarging number. So family medicine is a comprehensive care which helps patients of all ages. It doesn't discriminate on age, so whether it's from a newborn till seniors who are the elderly people, we take care of those, give them comprehensive care, patient-centered care, so your care plan will not be the same as someone else's care plan. And we practice evidence-based medicine. We use research that has shown to benefit patients, whether it's black or white or yellow or brown. So like medication which is specifically helpful for that area, not just textbook material, but material that has shown to improve the lives of others. And we also build long-term relationships with our patients. So when you start with me today, I'll continuously be your doctor along the way. You don't have to switch and get a different doctor who will now start changing plans and doesn't know your history.
That is very beautiful, and I feel that is one of the greatest importance of it, because you really have to know someone, and like even some patients, they get to feel it's monotonous being asked the same question, where you have to start building a rapport and all those things.
Yes.
Yeah, I love it. Are there any other importances of having family medicine apart from having the same doctor to carry me throughout?
Family medicine is also preventative care. So it's not just treating a disease, but it's also preventing you from getting that disease. And the aim is to make sure that we change the disparities or the norm that is there in treating patients, to make sure that there's less morbidity and mortality, that is less disease and less death that comes to those.
Okay. All right. No, I really love that. I think I need me a family doctor to attend to my family.
You're most welcome to.
Okay, now I bring you to the topic that we have at hand today, which is hypertension. I know it's become very common these days, and with a lot of myths and misconceptions out there. What is hypertension, and why is it referred to as a silent killer?
Okay, maybe I should address why it's referred to as silent killer. It's referred to that because patients might be having symptoms, but they're not obvious.
Oh, yeah.
So they can't feel it, but their BPs are higher. And in some cases, we have some patients who just collapse without knowing that they had that condition. Hypertension, with use of, I'll use my hands to illustrate.
Okay.
We have what we call systolic and what we call diastolic. Systolic is when the heart, it contracts, when it's having a heartbeat, and then diastolic is when the heart relaxes. There will be where the heart is not working properly in those instances, and either the diastolic or the systolic will be increased. Normally, the normal diastolic and systolic would be 120 over 70. Anything more than that, between above 120 and above 70, would be elevated blood pressure. When you have stage 1 blood pressure, it's 130 to 139 and 80 to 89. When you have second stage blood pressure, it's more than 140 and more than 90 in the diastolic. Most patients have primary hypertension, in which we don't know the primary cause, the cause of that happening, and other patients might have, which are a smaller number, will have secondary hypertension, which are caused by kidney disease or hormonal disorders, and at time medication that we take, such as contraceptives and antidepressants, as well as painkillers, NSAIDs, and non-steroidal medication. Anti-inflammatory drugs. There's that one.
Oh, wow. This is getting interesting. So I've heard, we've talked about, so when we say primary, secondary, do we also have a tertiary one, or it's just primary, secondary, and then it's in stage 1, stage 2, and...
It's mainly primary and secondary, and then we differentiate between normal, elevated, stage 1, and stage 2.
Okay.
Stage 2 covers anything above 140 over 90.
All right. Okay. Thank you. Another condition that I've heard people, they usually have it as comorbidity, diabetes mellitus, sugar disease. Most of the time, people have hypertension. Some also have diabetes mellitus. So what is the correlation between hypertension and diabetes?
In layman terms, diabetes is when the body is unable to process or store the glucose, which is the sugar. That's why people call it sugar disease. It also causes problems where the way the body stores and processes other forms of energy, including fat in the body. The cells, all cells in the body need the glucose. But when they are unable, and for the glucose to get to the cells, we need insulin. When insulin is not taken up, or there's not enough insulin, that's where it causes the sugar to build up in the blood, and that's where diabetes comes in, or sugar disease. There are two types of diabetes. We have type 1 and type 2. In type 1 is where the pancreas is unable, it stops making insulin completely. And usually that's genetic. You'll see younger people with that who have had it from birth. And then in type 2 is when the body is unable to process the normal or higher levels of insulin in the body. And eventually, the pancreas will not be making enough insulin for the body. Insulin resistance and diabetes, they actually cause metabolic disorders, which is where the body is unable to function properly in inside, and that leads it can correlate or coexist with the hypertension and other metabolic disorders or other heart diseases or cardiovascular diseases.
Wow. So at least there you have it, listeners and viewers out there. If you've just tuned in, this is the Tele-Doctor Show. The number is being displayed on the bottom of the screen where you can call us and ask us. Today we are discussing hypertension. So before we take our break, I wanted to really now dive into the predisposing factors of hypertension. Who is at a higher risk of getting hypertension?
It's a vast question. However, the people who are at higher risk of getting hypertension is people who are not active, physical activity.
Okay.
So if you're a couch potato, you're not you're at higher risk of getting it.
Yeah.
Then the older you get, the higher the risk of you getting hypertension as well.
Okay.
Then obese people who are overly overweight. Family history of hypertension.
Okay, sorry, we have a caller in. Hello, welcome to the Tele-Doctor Show. Good evening.
Yes, good evening, madam.
How are you, Mr. Ranger Tembo? How's Kitwe?
Yeah, I'm fine. I'm very well.
Oh.
I wanted to find out from the doctor.
Yes,
I've
please.
got hypertension, but I always sweat when I'm eating. I always sweat from when I'm eating.
Okay.
Yeah, I've been diagnosed with hypertension, and I'm only taking Infedipine, so I don't know what other medication I can change in. Because I've been taking Infedipine for a long time, but still it doesn't make any difference to me.
How long ago were you diagnosed as having hypertension, Mr. Tembo?
Yeah, it's now almost 5 to 6 years now. I'm still having hypertension, and also I'm a stroke patient, you see.
Oh, okay, okay. When did you have the stroke?
But every time I'm eating, I'm sweating from my forehead.
When did you have the stroke, sir?
Stroke I had in 2023.
2023. All right. Thank you so very much for that candid question, and we'll be responding to you just now.
Okay, madam.
Okay, thank you. So we had a caller, Mr. Ranger Tembo. So before you tell us the risk factors and who is predisposed to having the hypertension, I think it's candid that we respond to his question. So he says he's been diagnosed as having hypertension for the past 5 to 6 years, and he's just taking Nifedipine, but now he's asking why he's sweated, especially when eating, and on his forehead. Yeah.
Okay.
Yeah.
Thank you for that question, Mr. Tembo. I would advise that he would come to be seen. It wouldn't be candid to give a diagnosis and a treatment without seeing him. There's a workup that we do as family physicians where we check your liver functions and your kidney functions, as well as to other parameters that we have to check and be able to see how that goes with you. If it's the medication, there are other options that we can give him where we can change it to a different medication which might be more suited to him specifically, or if we need to add another one to assist, we will do just that.
Beautiful. And he also suffered from a stroke in 2023. Yeah. So, Mr. Tembo, if you're still watching this show, please get in touch with our Tele-Doctor customer service line so that we see how best we can link you to the nearest clinic, because after your stroke wake up, there are other questions that you need to be asked by your physician, and there's a stroke unit just there on the copper belt. So reach us out on our Tele-Doctor customer service line, which is 0979 904-046, and we'll be able to help you out. So we were now talking about the predisposing factors, those who are at a higher risk, and also the predisposing factors.
We had left it off at family history.
Yes.
So if you have a family history of especially immediate family or nuclear family, you would say your mother's sister or your mother or your father has hypertension, you're also most likely to have that. In this now, currently, most people have a very high salt intake. So a high salt intake in your diet will also predispose you to diabetes. Also, high alcohol. If you're taking a lot of alcohol, that also takes you there. Smoking as well, and not enough sleep. If you're not getting enough sleep, that also predisposes you to hypertension.
Okay. Talking about Salt intake. There are certain myths and misconceptions which I want us now to address before our break. The people who say you're not supposed to add salt to already cooked food. So is it important just to have it cooked, or you can also have it raw on your food? Like after the food is prepared, then you start sprinkling there before you eat?
It depends on the household. Not all households are the same. Most households will maybe have Royco. Royco already has salt.
Yeah.
That's why we end up saying, please don't add salt afterwards. There are other options that can be used instead of adding salt. If you still want that kick of something salty, like black pepper, for instance, or cayenne pepper. Of course, those are spicy, but they elevate as much as they can. Because of the number of spices that people use, we do advise that they rather not add salt after cooking. Those who do not add any spices whilst they're cooking, I guess they could add afterwards so that it's not as much. Because when you're cooking, you might think you're not putting enough salt, but you're actually putting quite a bit.
Yeah.
But if you're putting at the end, the salt becomes more predominant in the mouth.
Exactly. Wow. Thank you. If you've just tuned in, this is the Tele-Doctor Show. We are talking about hypertension today, and right now we're going to take a quick short break and we'll be right back. Stay tuned. Did you know that 46% of the deaths that we record in Zambia are as a result of inadequate access to healthcare services? Seeing that that was a gap, Tele-Doctor was birthed because it was working in line with what the Ministry of Health wants, which is providing effective and quality healthcare as close to the family as possible. We want to bridge the gap by telling you to get your smartphone and just download the app. Once you download the app, you can actually book for an appointment with a doctor or any licensed medical personnel. Do you also need a refill with your prescription? Quite all right, we do that and deliver the drugs from the comfort of your own home at your doorstep. So you can download the app or visit our website for more information. Welcome back. It is the Tele-Doctor Show and we're discussing hypertension today. So I'm going to ask my lovely Dr. Dube, what's the role of family doctors in the prevention of hypertension?
The role of family doctors is quite vast. We help with early detection and diagnosis of the disease, as well as the treatment and the management. Then we have multidisciplinary care coordination, so it doesn't just end with us. If it's beyond us, we will refer or talk to a specialist in say that area who can help the patients. Then we also have prevention and health promotion, which actually Family Medicine Day is on the 19th of May, which is next week, Monday.
Wow.
Then we also address comorbidities. If you have other diseases that are apart from the hypertension, so you have hypertension and diabetes, or you have hypertension and a stroke, or and so on and so forth, we do help patients with that.
Beautiful. And 19th of May, so every year you commemorate that day, or it's just starting this year?
Every year is family, and 19th of May is Family Medicine Day.
Okay.
However, we'll be celebrating it this year, so we will do something to give more awareness to family medicine here in Zambia.
Oh, wow. Beautiful. I'm going to take part in that.
Thank you. You should.
Then, you know, there are times when I'll just come to the hospital and you check my BP and then it's elevated. And then they'll start asking me questions. Have you been hypertensive? I'll just be like, no, it's just today. When can we classify that this patient is hypertensive?
Okay. So we don't immediately say, because today you've come in and your BP is 145 over 95, that you're hypertensive. No, we give you time. In other places, we have what we call ambulatory BP measurement, where there's actually a halter that is worn, like a BP cuff, that you wear throughout the day and doing what you're doing, that measures you outside the hospital. And then we have, which is what is common here, is the self-BP measurement, where you're going home and you're measuring your BP if you have a BP machine. At times we tell patients that they should go to the nearest pharmacy or the nearest clinic to check for themselves. If you've been to most of our clinics, we ask you to buy a little book, and then you write down your BP in the morning and your BP in the evening. After some rest. So if you're going to walk to the pharmacy, just rest for a little bit before you measure your BP. After a week or two, we usually use 2 weeks, and you come back and you see us, and we see the measurements, how your BPs have been. If they've consistently been above 130/90, then we can say this patient has hypertension, BP. However, if you can't measure by yourselves outside, and you come to the clinic, let's say you've come to the clinic to see me today, and on that visit your BP is 180/120, I can say you have BP. If you come and your BP is 160/100, but you have target organ damage, let's say a headache, or you have backache, difficulty urinating, or you have a stroke, then we say this patient has BP and we have to manage it.
Okay. Oh, this is wonderful. At least it even answers the question, because I know certain patients out there find it like cumbersome for them to record their BPs from home and then come with them. But I think now it answers. And there are just certain specific people that I've actually, in my practice of work, practicing as a nurse, there are clients who would come when they are home, the BP would be normal, but when they come to the hospital, it will be slightly elevated. I don't know if it's because of the phobia of the environment, when they see cots here and there. So at least this answers and settles it. As they are home in their relaxed state, they can check the BP and still come with them both home.
There's actually what we call white coat hypertension.
So it is real.
Yes, it is real. And masked hypertension. Where patients come in, and I think they just get anxious when they see their doctor. In some institutions, they actually don't wear white coats anymore, so to make patients more comfortable. Because once you come in and you see me in a white coat and a mask, your anxiety just goes up, and so does your BP.
Exactly, exactly. So white coat hypertension is real, and just because someone's BP is always normal, when you come to the hospital you find it's elevated, it's important to go and do the readings from home so that you can come and compare with what we're finding at the institution. Okay, so on hypertension, this disease, is it curable, and what preventive measures should I do?
The short answer for whether it's curable is no.
Okay.
It's treatable. It tends to be a lifelong condition, that a chronic condition which you have to manage. There are two specific ways in which you can treat: the non-pharmacological way, which is not using medication, and the pharmacological way, using medication. In the non-pharmacological way, it's lifestyle changes. If you're not getting enough sleep, we change that.
Yeah.
If you're taking a lot of salt, we restrict salt intake. If you're obese or overweight, we ask you to lose weight. In the clinic, the family medicine clinic, we usually have patients who have an issue with when we tell them, you need to start exercising. And most will tell you, I already exercise. And you ask them, what exercise do you do? I walk to work. We need you to sweat a bit and do a bit of cardio. So if you're doing brisk walking, that's different, because it elevates your pulse rate as compared to just walking. Some people just walk and it's a brisk walk and it's slow. It's you won't even feel like you've sweated or anything. So in short, we tell them, okay, can you please sweat a bit? Then we have the dietary approach to stop hypertension, which is called the DASH diet. Limiting alcohol and smoking as well, limiting that, and stress management. Stress combat, it actually adds on to hypertension more than you'd actually know.
Exactly.
In pharmacological, if the lifestyle changes is consistently above 130/80, then that's when we start introducing the medications. And if you have comorbidities, if you have other heart disease, or you have a previous stroke, then we add a medication accordingly, and medications which are not going to clash with each other, that will work well together and get you better. So we continue seeing you whilst you're on the medication. Sometimes we might ask for every 2 weeks, every month. it's different from patient to patient, because we want to make sure that you're getting the optimum care before we can actually say, we'll see you after 3 months, or we'll see you after 6 months. And when it mixes with diabetes, it becomes even more complicated.
Exactly.
So you definitely have to be on medication if you have diabetes and you also have hypertension. If you have kidney disease as well, we have to put you on medication. Above 65, because you never know what happens with this elderly. We have to put them on that. And there's something that we call the ASCVD score, which is the atherosclerotic cardiovascular disease score, which we calculate over 10 years to see if you have any risk of having maybe a stroke. If your risk is higher than a certain percentage, then we have to put you on medication.
Wow. Okay, so this is beautiful. I know some people will be like, no, once you start taking your medicine, you have to take it for life. So when you go to the hospital, don't allow them to give you the BP medication. What's your comment about that? Because even I have some stubborn relatives of mine who are hypertensive. But just because you tell them, start taking the drugs, they'll be like, oh, Nadineka, because I started feeling better and all that. So what's your comment about someone who starts and then they later stop because of people who are influencing them and all that?
Prevention is better than cure. So you'd rather stop it now if you don't want to end up taking medication. Otherwise, you would have to continue taking it, even if the BP looks normal after taking the medication for a certain period of time. It doesn't mean that the hypertension has gone away. It means that the hypertension is being controlled at the present time.
I'm going to ask about a wonderful group where you and I will also find ourselves soon again, or maybe we are there, we don't know. The pregnant women, because I've heard of pregnancy-induced hypertension. Just wanted to find out, how does that come about? How can one have the hypertension when they're pregnant?
We call it gestational hypertension, and in some cases it evolves to preeclampsia or eclampsia. Usually these are hypertensive disorders that resolve after you give birth. If it doesn't resolve after 12 weeks of giving birth, then it becomes chronic hypertension. I think because of the pressure that happens as the baby grows and the stomach becomes bigger, there's also compression of the organs, and the BP will increase in that case. And when we say preeclampsia or eclampsia, it's when now you've seen, if you've been pregnant or you've seen pregnant women, we ask them to come for checkups more occasionally, and we'll check the BP, we'll check the urine as well. The elevation of the urine protein, that if it's there, if we find that there's proteinuria, then we start thinking of preeclampsia or eclampsia, and we have to monitor them more closely before they end up having target organ damage in this case. But it's not just any BP. It's not the same as another person, which is 130/80. This would be more than 140, more than or equal to 140 over more than or equal to 90 in that degree. The absence of those end organs the end organ dysfunction of the organs not working, maybe the kidneys or something, it can be associated with preeclampsia. But if there is end organ, then we associate it with eclampsia. So talking about these, I've heard it affects a lot of, like, especially childbirth, because we've heard of the complication, either eclampsia or preeclampsia. But does gestational hypertension have any effects on the pregnancy itself? Like, what usually happens to the outcome of the unborn? I'll give an example for when it comes to eclampsia. We see some women who have seizures, fits. That can lead to the oxygenated blood not reaching the baby. That's why in most cases we make sure that we deliver the baby sooner rather than later in those cases. if the woman has made sure to take care of themselves all along the pregnancy, when they have gotten the gestational hypertension, there is less to none effect on the baby themselves. We just want to make sure that the baby is getting all the nutrients that they need to get. That's why we want to make sure we catch it quickly and deal with it quickly.
Oh, beautiful. That's why it's important, viewers out there, for you to go for your antenatal services. It's not just for the parameters of monitoring the woman who's carrying the child, but we also want to monitor how the baby is growing. So when we tell you, no, come, if it means going every week, it's because there's an alert that we've seen and we want to prevent. You know, we're talking about prevention is better than cure, so we want to prevent it from becoming a chronic condition on your part. Dr. Dube, I wanted to find out on the approach of hypertension when one is diagnosed with hypertension. What is it that you do as the family doctors in the caring of these clients? I know you talked about prevention and all that,
yes,
but maybe someone has just tuned in and it wouldn't hurt to repeat.
Okay. So the first steps we do is to have a continuous BP monitoring where you're checking your BP at home, away from the office, because office BPs are usually, they give a poor result.
Exactly.
Because of the white coat or masked hypertension, which is actually a real thing, like you mentioned earlier. It's not a myth. From there, we ask you to change your lifestyle. If you're overweight, we ask you to lose weight. If you're smoking, we ask you to stop smoking. If you're taking a lot of alcohol, ask you to reduce the alcohol. If you're not getting enough sleep, you also increase in the number of hours that you sleep. So you get better rested and your heart also gets some rest as well. We also ask you to check salt intake. A lot of diets these days have a lot of salt. Ask you to reduce those as well. And watching your diet predominantly, see how it works. From there, when you've come back and you're consistently above 130/80, then we can diagnose you with hypertension. And if that happens, then we ask that you start on medication. We start with one. If one is not working and we reach a max dose, we don't just give you a cocktail of medication and say, take these 6 and use them. No. We start with one and see how that works, and we see you over a certain period, if it's every 2 weeks or it's every month, to see how you're faring, to make sure that we are reaching the optimum health for yourself. For each patient, it's a different plan. It's not going to be the same, because that's why we pride on primary patient-centered care.
I love that, and because you've talked about primary patient-centered care, it's beautiful. And can we have people who are like maybe the pediatrics, someone is 15 years old, and what age can one be diagnosed with hypertension? Is it all, even peds, neonates and whatever?
Yes, actually, it doesn't discriminate on the age. Of course, as you get older, it predisposes you more to hypertension, but age is not, it's just a number.
It's just a number.
Yes.
I love that. I asked it because there are certain people who pass a comment, you're too young to have hypertension, because most of them think it's just stress related. What are you thinking? For you, your BP is high. And I'm not thinking about anything. So I love the fact that we've actually talked about the predisposing factors, and it helps. So if you've tuned in, we're talking about hypertension. This is the Teledoctor Show, and please download the app, because on the app that we have, it will spare you the hassle of you looking for a book and recording your BP. It will monitor for you, like when you do your BPs, you enter your digits on the app, and it will be able to show you the trend on whether you are having high blood pressures or low blood pressures, or was it within the normal range, and are you obese. So we help by checking your weight, your height, and then you're going to put in those details in the app so that you can know if you really need to reduce weight or not. So there's a number that's displayed on the screen, which you can call us. Remember, this is a live and a phone-in program. Some of you would want to call us as the Teledoctor customer service line. Please call us on 0979 904 046. And we're going to take a quick break. When we're back, it's the section that I love the most, the quiz, where we're going to deal with facts and myths. Stay tuned. Back. I love this part of the show where you have myths and facts about a certain topic that we talk about. You know, this is something that we do only as tele-doctor. So get your pen and your paper and see if you've gotten some knowledge about this, because this is just like a knowledge access that you're going to do. You're assessing yourself to it. Okay. So I have 4 questions with me and let's see what you fare. So Dr. Dube, the first question that I have is, hypertension is a disease of the elderly. Is this true or false?
It's false.
Care to elaborate?
It touches all ages. Children can have it. Not elderly people. People my age can have it. It touches everyone. It's not selective to say. Sister Malango, I've chosen you today.
Tomorrow someone
else. It affects just anyone.
Thank you. And the second one that I have is patients can stop taking medication when their BP is normal. True or false?
False. When you're on the medication and it controls the BP, you will see like your BP has gone to normal. That doesn't mean that you should stop and you're much better, because this is a chronic condition. You need to still continue taking it and continue with the lifestyle modifications to make sure that you stay in that normal BP range that you're seeing with the medication and the lifestyle changes that you've put into place.
Exactly. And this other one, hypertension is part of the normal aging process. Almost everyone is expected to have it.
No,
false?
No, false. It's false.
Yeah.
It's the inability of the heart, certain parts of the heart, to do its job properly.
Yeah.
If everyone would do it, I think it would be a very sick nation, because everyone would have to be on BP medication and walking around and checking their BPs every day. But it's not everyone who gets it, and it's not a normal part of aging.
Yeah. All right. The last but not the least, slim people are not at risk of developing hypertension or diabetes. Is this true or false?
False.
Can you explain?
False. I have a very normal hypertension, and I'm slightly bigger than slim people.
Yeah.
Actually, in some studies, it has shown that slim people have more BP than those who are actually obese. It's not selective that it's just obese people, overweight people who are going to get the hypertension. Also, slim people can get it.
Wow. At least I got 100%. I don't know about you, the viewers out there, and what you got. And Dr. Dube, any words of encouragement that you would want the viewers and everyone who's joined us today? What word of encouragement that you can give them about hypertension?
I would say hypertension is not an end of life. It can be treated and it can be well controlled. You need to put in the work. It's not just your doctor who has to put in your work. You have to put in the work yourself to make sure that you reach optimum health. Please come and see family medicine.
I love
We'll
that.
take care of you.
Yeah.
And prevention is better than cure.
Exactly. It's actually cheaper.
Yes, it is. Much, much cheaper.
Yeah. No, thank you so very much for coming on the Tele Doctor Show. It's been an honor to have you.
Thank you, Sister Malango, for having me.
Okay. Thank you so much for tuning in. Today we're now going to tell you about the clinics and other services that we offer as Teledoctor. So we have the skincare clinic that we have with our partnering clinics. That's Woodland Specialist Clinic, Chuya Mwenechanya in Ibex, and also Abacus along Kafua Road. So if you have any condition that you want us to see, please do call us. We also have a men's clinic every Saturday at Woodland Specialist Clinic, but that does not mean the other clinics do not offer that. We do offer in our partnering clinics. We also have, we've been discussing today about hypertension and diabetes. So we have that family medicine of hypertension and diabetic clinic at Woodland Specialist Clinic, Chuya Mwenechanya, and Abacus Clinic. We love our babies and they are not left out. So we have also pediatric clinics that we offer and under 5 services that you want. We have a neurology clinic. So if you have any condition, headaches, and you are a stroke survivor, you can get to call us. We also have an orthopedic clinic at Woodland Specialist Clinic and our other partnering clinic, Abacus Clinic and Chuya Mwenechanya. We also have a fertility clinic that we have if you're struggling with fertility issues, excruciating period pains and all those things. Please do visit us. We encourage you to download the app so that you can get to book a booking with any of the consultants that you want. So you can scan, either if you have the Apple phone, use the iOS this side, and you can also use the Android, and it's going to take you as a shortcut so that you can download and use our app. And those are the access to tele doctor mobile application, and this is what we do. So there's each member of staff will have access to an app, and we have the consultations fee which are there. Members of staff will also have access to healthcare navigating a system in Zambia, which includes admission, diagnostic support, home doctor service, medical evacuations as required. So that is why it's important to have the teledoctor mobile app with us. All right, thank you so very much. Please, if you want any of our services that we offer, even the first aid services, we teach companies and corporates that will really need to learn. Thank you for tuning in. I've been your host. My name is Sister Malango Goma, and I'm signing out. Please be hypertension smart. Until next time, tune in tomorrow at 9 to 10 hours on Radio Phoenix, where we're going to talk about something that is going to benefit your health. Until next time, bye-bye.